There's no such thing as lack of information when enrolling into Medicare. Most people say they're overwhelmed with Medicare information. Whether it's flyers in the mail every day, commercials all hours of the night, even phone calls from captive agents trying to sell their own plans, even if it's not the best one for you. There's so much confusion that individuals get frustrated with the process and end up making hasty decisions based upon friends' recommendations. The problem is that a few years later, when a medical issue arises, they find out they made a huge mistake when they enrolled. And the sad part is that it's usually too late to do anything about it.
FSA Health Insurance Agency has been helping simplify the Medicare process for nearly a decade. There's no organization in the country that makes the process as simple as Satara and her experienced FSA Health team. Through her educational videos and one-on-one discussions, she'll make Medicare seem easy. You'll be hearing from the best of the best. Satara has educated countless people about how they can get the best Medicare coverage available. After listening to Satara, everything's going to fall into place. You'll know exactly what you need to do and when you need to do it. You'll understand how and when to enroll, what plans to consider, and what plans to avoid. She'll explain all the penalties and tricky rules you'll need to understand. The bottom line is Medicare will finally make sense. You won't be confused. You won't make mistakes. You'll be confident and have clarity. So sit back and enjoy.
I want to thank you for the opportunity to assist you with your upcoming enrollment into Medicare. In this video, I'm going to talk about Medicare basics, what it is, who can get it, and what it covers, and then finish up with a discussion about the enrollment timeline. Let's get started.
So one might ask, what is Medicare? Well, Medicare was created in 1965 and is the federal health insurance program funded in part by the taxes you pay while working. It's really important to know that Medicare is individual insurance and not a family health plan. So if you are covered by an employer plan and retire, go on to Medicare, but your spouse isn't yet eligible, you'll need to find individual coverage for your spouse until they become eligible. Again, Medicare is for individuals who are 65 years and older or younger than 65 with a qualifying disability. Keep in mind that individuals may also qualify at any age with a diagnosis of end-stage renal disease.
Now that we know who qualifies for Medicare, let's talk about what Medicare covers.
There are 4 different parts of Medicare, which cover specific services. First, I'm going to discuss Original Medicare, which consists of Part A, hospital insurance, and Part B, medical insurance. So let's take a closer look at what Part A covers. As you can see, pretty much anything that would be required for your hospital stay is covered by Part A. This includes room and board, care and special units, such as intensive care. Part A will even cover drugs and medical supplies while admitted, lab tests, x-rays, operating, and recovery room services. It even covers skilled nursing services, as well as hospice care and some part-time skilled care or rehabilitation for the homebound if it's after a qualified inpatient stay. Something to note is that Part A for most people is premium free as long as you or your spouse has paid Medicare taxes for at least 10 years. Also, you cannot be denied coverage in any nationwide hospital or doctor office that participates with Medicare. The second part of Original Medicare is Part B, which is medical insurance. This covers doctor's fees, including annual wellness visits and preventative services like the flu shots. It will cover blood and urine tests, x-rays, MRI, CT scans, diabetic screenings, as well as mental health care. It also covers outpatient hospital visits, such as physical therapy, occupational therapy, and even speech therapy. Not to mention other medical services and supplies, such as durable medical equipment. As you can see, Medicare covers a lot, but it's important to know that Original Medicare doesn't cover everything. We will cover a bit more on that in a minute. Some important information to point out are the monthly costs associated with your Part B premium. This monthly premium can be adjusted each year based upon your previous year's income. They will look at your income from 2 years earlier. If you aren't sure what modified adjusted gross income is, make sure you check out our IRMA video. So just like Part A, you cannot be denied coverage nationwide. But most importantly is the lifetime penalty you may incur if you don't enroll at the right time. I'll talk about when to enroll and avoid the penalties in just a little bit. As you can see, Original Medicare Part A and Part B covers a lot, but it's critical to understand that it does not cover everything. So Original Medicare covers about 80%, and you are still subject to out-of-pocket costs with no limit. So for example, Original Medicare does not cover prescription drugs, routine dental, vision and hearing, long-term care, custodial care, excess charges for doctors who don't even accept Medicare cost structure, and care received outside the U.S. except for certain circumstances.
Now that you know that Original Medicare doesn't cover everything, let's look at just how much you could be on the hook for if you need care and only have Original Medicare A and B.
Let's take a look at our out-of-pocket expenses with Part A if you are hospitalized. As we mentioned, there is no premium for Part A for most people, but if you are hospitalized, your deductible is $1,632 per benefit period, which is up to 60 days. As you may recall, deductible means you pay the entire amount before Part A kicks in, so there's no way to avoid this with only Original Medicare. For example, if you stay in a hospital for 60 days, you'll pay $1,632, but for every day over 60 days, you pay an additional $400 per day. Copay for the next 30 days. That's another $12,000 out of pocket. It doesn't stop there. If you are still hospitalized after 90 days, your copay goes up to $800 per day. That's another $48,000 for the 60-day period, but you only get that extra 60 days of coverage for your lifetime. After that, you pay 100% of your hospital stay. Luckily, most hospital stays are nowhere near 150 days, but if it does happen to you, there goes your 401k. And finally, there's no out-of-pocket limit on your Part A costs.
As you can see, a long hospital stay can devastate a family financially if you don't have the right coverage. I'll show you how simple it is to protect yourself from these charges later.
Now let's look at our out-of-pocket costs with Part B. As mentioned, your premium is paid monthly, but you also have a deductible to pay before any coverage kicks in. Once you pay that, Medicare will cover 80% of the services and you pay the remaining 20%. However, if you choose a doctor who does not agree to Medicare's cost structure, you'll also pay the excess charges. So make sure you verify that your doctor accepts Medicare assignment. And just like Part A, there's no out-of-pocket limit to your share of Part B costs.
Let's talk about how to get prescription coverage from Medicare. There are only two ways to get prescription coverage. I'm going to talk about one now, which is a standalone Part D prescription drug plan.
Part D plans are not considered part of Original Medicare since it wasn't available until 2006. That means you have to sign up for Part D in addition to enrolling in Parts A and B. With Part D, you cannot be denied coverage and there's a monthly premium. Most people do not have any problems finding the drugs they need in the Medicare formulary, which is created by federal standards, not the insurance companies themselves. There are brand name and generic drugs included for most drugs. It's important to know that Part D providers group their drugs into different tiers. Ultimately, the lower the tier, the lower the cost. For example, Tier 1 drugs will cost less than Tier 2 drugs, and so on. The reason why this is so important is because different companies may have the drugs you take in a different tier. If Company A has your drug as Tier 3, but Company B has it as Tier 2 or Tier 1, you could save a lot of money with Company B. That's why we ask for your current prescriptions when we help you choose the right Medicare plan. To get a Part D plan, you must be enrolled in Part A or B and will be likely required to use a specific network. Keep in mind, as with Part B, you'll have a monthly premium, and if you don't sign up for Part D when you're first eligible, you may have a lifetime penalty. Part D plans have a complicated cost-sharing feature I want to explain right now. First, most plans, but not all, have a deductible before coverage kicks in. This is the amount you pay each year for your prescription before your Medicare drug plan pays its share. Once you have met your deductible, you are in the initial coverage stage. This means you pay your plan's stated copay while your plan pays its share for covered drugs. These amounts may vary depending on the plan you choose. Once you and your drug plan spend $5,030, including the deductible, you have entered the coverage gap phase. which is referred to as the donut hole. During this phase, you'll pay no more than 25% of the cost for prescription drugs until your out-of-pocket spending is $8,000. Once your out-of-pocket spending reaches $8,000, you enter the catastrophic phase. This means you'll pay nothing for your covered Part D drugs for the rest of the calendar year.
Each year, the cycle starts over January 1st with the new numbers that CMS puts out for that year. I know it might seem impossible for you to predict your yearly drug costs, but it's actually very easy for the medication you already take. By gathering a list of medication names and dosage, along with how often you take it, we can provide a very accurate prediction of about how much your prescriptions will cost for that upcoming year, which is why working with FSA Health is so beneficial.
As I mentioned earlier, there are two ways to get prescription drug coverage under Medicare. First, we have Part D plans, which we just discussed. Second, we have Medicare Advantage plans that include prescription drug coverage. Medicare Advantage plans are also referred to as Part C plans, which I will cover further in another video.
Now that you understand the monthly costs and eligibility of Medicare, it's important to know how to navigate the Medicare enrollment process to ensure you have the right coverage at the right time. To simplify your enrollment periods, I am briefly going to discuss for those enrolling into Medicare at age 65. For individuals that are working past age 65, you'll want to look out for additional videos in the future regarding special enrollment periods. But for now, let's take a look.
As you approach age 65, you have what's called an initial enrollment period. This is 3 months before the month you turn 65, your birth month, and 3 months after your birth month, giving you a 7-month window. One thing I want to point out is if you are born on the first of the month, whichever month that is, your enrollment period will begin 1 month prior. So just remember, if you want your coverage to begin the first day of the month you turn 65, you will want to apply at least 2 to 3 months prior to your birth month. Let's say you miss your initial enrollment period and do not have access to a special enrollment period. You will have to enroll during the general enrollment period. This occurs during January 1st through March 31st of every year. If you enroll during this period, your coverage will begin the first day of the month after you apply. So for example, if you apply in February, your Part B will take effect March 1st.
As you can see, the enrollment periods we just discussed are important to understand. Missing the proper enrollment period can result in lifelong penalties, which is why we encourage you to reach out to us at least 3 months before you turn 65. During this time, we'll be able to provide you with recommendations, along with tools and resources to assist with filling in the gaps of Medicare coverage. You're not alone, which is why we want to ensure you're making the right choices based upon your individual needs.